When managing high blood pressure, it's important not to lower it too much, even if patient feels fine. The American College of Cardiology and American Heart Association suggest being careful when the bottom number, called diastolic blood pressure, drops below 60. Uh, this is especially important for older adults or people with heart disease because very low diastolic blood pressure can reduce blood flow to the heart, raising the risk of chest pain or heart damage. One large study called SPRINT trial showed that bringing the top number called systolic blood pressure below 120 can lower the risk of heart attacks and strokes. But it also led to more cases of low blood pressure, fainting, and kidney problems. So while aiming for lower numbers might help in some people, it can also cause harm if not carefully watched. In patients without symptoms, doctors generally start to worry when the diastolic blood pressure is below 60 or the systolic blood pressure drops under 110. At those levels, the risk for heart issues or other complications tend to go up. That's why doctors often look beyond just the numbers and focus on patients' overall health and risk factors. For people with stiff arteries or a large gap between the top and bottom numbers, known as wide pulse pressure, very low diastolic pressure can be especially risky. These patients may need more careful blood pressure targets to avoid cutting off supply to the heart. In the end, managing blood pressure is about balance. Lowering it too far can be just as dangerous as leaving it too high. The doctors use regular check-ins and blood pressure monitoring to make sure treatments is helping without causing side effects. The goal is always to protect the heart while keeping the patient safe and feeling well.